Let's talk about stroke in the emergency room. So as a nurse, when you have a patient who comes in with a stroke, one of the most important things is to know the last well known. You want to also document all of your vital signs, but the most important vital sign at this point is the patient's blood pressure. You need to assess your patient. What are their signs of stroke? Is it facial drooping, hemiparesis? Do they have trouble smiling? There's the FAST assessment. Make sure you're documenting the patient's baseline assessment because you have to do the glaucoma scale, GCS, and the NIH stroke scale. What is the time from the patient's arrival to the ED to CAT scan? That's very time sensitive. And what are the results of the CAT scan? Will the patient need TPA? Make sure that you know the contraindications for TPA. The stroke or neuro team will be there. They're the ones who are guiding care. If the patient does need TPA, it's very important to know the patient's weight. Very important, if the patient's going to have TPA, one of the major risks is bleeding. So any procedure that would cause the patient to bleed, whether that is blood drawing, a Foley, you need to do before you start TPA because there is no sticking this patient once they start TPA. And once you start TPA, neuro checks are so important. You're going to have to do Q15 neuro checks, assessments, Q15, Q30, within the first hour or 2 hours. It's every 15 minutes, and then after that it goes from Q30 to an hour, etc. Just remember, everything is time sensitive. You need to know the last well known, and you must track and trend the vitals for this patient. Comment down below if there's any other advice or tips you have for nurses managing stroke patients.